Welcome back, everyone. For this lecture, we're going to discuss chronic hematologic emergencies. The first hematologic emergency we're going to talk about is anemia. Anemia is low hemoglobin or erythrocyte levels and is typically associated with blood loss or underlying disease that complicate the production of red blood cells. It results in decreased erythrocytes and can also occur from other hemolytic disorders. Iron deficiency anemia is the most common type, and causes include gastrointestinal blood loss, menstrual bleeding, or frequent blood donations and diagnostic tests, as well as low birth weight. Potential causes for this, you can have things like inherited hemolytic disorders or hematologic disorders, as well as a deficiency in the G6 phosphate dehydrogenase system, and autoimmune disorders can also play a role. As a reminder, anemia by definition being a reduction in red blood cells, we can see complications of this disease, particularly for patients at high altitudes, as the oxygen carrying capacity of the blood is reduced. For management of these patients and assessment of these patients, the patients may present to EMS providers by feeling worn down and having a lack of energy. They may describe feeling overexerted or being unable to catch their breath. It's also not uncommon for patients to complain of things like anginal type chest pain or chest pain that goes away at rest. Monitor airway and breathing as we do with all patients, and make sure we're assessing our vital signs frequently for these patients. For chest pain, we should apply the cardiac monitor and manage blood pressure and replace fluids for advanced providers if needed. Allow the patient to assume a position of comfort, and if there are abrupt changes in the level of consciousness, or if there's profound hypotension or significant perfusion inadequacies, you should consider rapid transport, and ALS interventions may be required. Leukemia is another chronic hematologic disorder, and it's a cancer in the lymphoid system. Abnormal development of blood cells can cause things like thrombocytopenia, leukocytosis, and anemia. Leukemia is broken down into two types of leukemia. We have acute leukemia, which is where the bone marrow is replaced with the abnormal lymphoblast or cancer cells, and chronic leukemia, where the abnormal cells are accumulating in places like bone marrow, lymph nodes, spleen, and in peripheral blood. You can see some of the presentation symptoms here for patients presenting with leukemia, things like lymph node swelling, loss of appetite, easy bleeding or bruising, pain or tenderness in the bone and joints, and shortness of breath are all common complaints. Survival for leukemia depends on several factors, including the stage of detection, any concomitant underlying medical factors, and how well the patient responds to treatment. Long-term treatment for leukemia is hallmarked by chemotherapy and radiation. Assessment for these patients use standard precautions, and patient presentation is going to largely depend on what stage the patient is in with their leukemia and their response to current treatment. Patients are common to present with things like fatigue and headaches, bone pain, or unexplained bleeding. Management for these patients is largely supportive care. We may need airway support and oxygen therapy, and advanced providers may need to provide analgesics and IV fluid therapy for supportive functions of the cardiovascular system. Emotional support is going to also be a key factor here, as leukemia is terrifying for patients and family members alike, of which it's important to remember that care providers on scene and family members on scene may also need care, EMS support. You may have psychological components and behavioral components that are difficult to deal with and manage on scene. So make sure you're assessing your scene for multiple patients, not just the patient with leukemia. Discuss with medical control if any additional interventions are needed, and document your findings. And if the patient refuses treatment, make sure you get the appropriate signatures in place and document that refusal of care. Lymphomas are a group of malignant diseases within the lymphoid system, and they're categorized into two categories, either non-Hodgkin's or Hodgkin's lymphoma. Non-Hodgkin lymphoma can occur at any age and can be hereditary. It's characterized by an indolent progression or a very slow progression, or it can be aggressive or highly aggressive, depending on the patient's presentation. Hodgkin's lymphoma is a progressive enlargement of the thyroid glands. It's very, very rare, and peak ages are 10 to 35 years and then way late in life. Common symptoms for lymphomas include things like night sweats, chills, persistent cough, itching, fatigue, bone pain, as well as swelling of the lymph nodes. Assessment for these patients are going to be largely your standard assessment for your EMS providers, so ensuring adequacy of airway breathing and circulation. Lymphomas do require chemotherapy and radiation. And if the patient is already diagnosed with lymphoma, ask about the type of cancer and treatment they're undergoing, as this can help clue you in onto what potential presentation you may see with this patient. Signs can include things like pallor and frequent body temperature changes. They may feel very hot and very cold. And then can also have problems with inadequate perfusion and abnormal ECG rhythms. And so advanced level providers should be keen for fluid support and blood pressure support, as well as ECG monitoring and intervention if needed. Manage pain aggressively in these patients. So if you are an advanced level provider and have pain control at your disposal, if they're in pain, treat the pain. Treat inadequate perfusion and abnormal heart rhythms accordingly with presentation, and initiate transport if their condition doesn't improve. Polycythemia is another of the chronic hematologic disorders, and it's an overproduction of red blood cells. And it results in increased blood viscosity or thickening of the blood and blood volume, and it can be caused by underlying existing diseases, living in high altitudes, or rare medical disorders that can lead to polycythemia. It can lead to other conditions, predominantly strokes and pulmonary emboli and myocardial infarctions are the things that we're most concerned about. Treatment may include things like phlebotomy or cancer type treatments. Assessment for these patients, your findings are going to vary widely depending on the underlying cause and level of pathophysiology for the patient. Note the extent and duration of any shortness of breath that may be experienced, and you can inquire if they've experienced any redness or pruritus of the skin or change in skin temperature. Make sure you get a thorough medical history, including medication list and things to be able to bring to definitive care. Management in the pre-hospital environment is going to be largely focused on the complaint. It's going to consist of supportive care, oxygen and IV as needed for these patients, and transport to the most appropriate facility. Multiple myelomas are a number of plasma cells in the bone marrow that start to increase abnormally and creates tumors within the bone. This tumor space-occupying tumors can cause a reduction in red blood cells and white blood cells, as well as platelet formation, as all of your blood cells are created within the bones themselves. And so anything that occupies space within that marrow can create complications in the production of those cells. Neoplastic cells may accelerate protein development in the blood. Patients may have weakness in the bones, and chemotherapy and other anti-cancer treatments may be given for these patients. For pre-hospital treatment, we're really looking at making sure we have standard precautions and standard supportive care, and findings are going to depend largely on the stage of the disease. Early stage complaints include things like fatigue and mild pain, while late stage can be hallmarked by hemorrhage, weight loss, bone fractures, and significant amount of pain. For BLS providers, it's going to be predominantly supportive care and transport to the appropriate facility, while advanced level providers may need to consider IV fluid therapy replacement and pain management for these patients.